Let's talk about something that's directly affecting your monthly check, and I mean right now, today. Over the past several months, there have been real confirmed changes to Social Security programs, changes that touch SSI recipients, SSDI recipients, and anyone still waiting on a pending claim. Some of those changes are good news. Some of them are things you genuinely need to be aware of so you're not caught off guard. We're going to break all of it down today. No fluff, no filler, just the numbers, the timeline, and what it means specifically for you and your household. And yes, we're going to address that $1,400 question. Where does that number come from? Is it real? Who could actually see a check at or near that amount? Let's get into it. For the past few years, millions of Americans on fixed incomes have been caught in a frustrating squeeze. The cost of groceries, rent, utilities, and medications kept climbing. And while Social Security did adjust payments each year, a lot of people felt like they were just barely keeping up or not keeping up at all. That's the whole reason the cost of living adjustment exists. It's not a bonus. It's not a gift. It's a formula built into the law, specifically tied to something called the Consumer Price Index for urban wage earners and clerical workers, or CPIW for short. When the cost of things goes up, your benefit is supposed to go up with it. That's the idea anyway. In 2025, that adjustment came in at 2.5%, a little help, but not dramatic. For 2026, the Social Security Administration announced a slightly higher figure, 2.8%, and that adjustment kicked in at the very end of last year, December 31st, 2025, for SSI recipients, with the broader changes showing up in January 2026 statements for SSDI and retirement recipients. So the increases are real and confirmed. Now let's talk about what they actually look like in dollars. Here's where it's worth slowing down and being specific, because the numbers vary quite a bit depending on your situation. For SSI, Supplemental Security Income, the maximum monthly federal benefit for an individual on SSI has risen to $994 per month in 2026. For a couple where both people receive SSI, the maximum is $1,191 per month. Now, that $994 figure represents the federal maximum. But here's the thing. Many states add their own supplemental payment on top of that federal base. If you live in a state like California, New York, or Massachusetts, your total monthly SSI payment can be meaningfully higher than the federal figure. So depending on where you live, your combined state and federal SSI payment could actually approach or exceed $1,100 or even $2,200 per month for individuals. That's an important detail a lot of people miss. Your SSI check is not just one number, it's potentially two layered together. For SSDI, Social Security Disability Insurance, SSDI works differently. Your monthly benefit is based on your earnings history, specifically the average of your highest earning years while you were working and paying into Social Security. So unlike SSI, there's no single flat number that applies to everyone. The average SSDI payment in 2026 is roughly $1,630 per month, about $44 more per month than the 2025 average of $1,586. For some people, it's less than that. For others, it's considerably more. The maximum possible SSDI benefit has increased to $4,152 per month, though that's for people with long work histories and high lifetime earnings. So where does $2,400 come in? A combined household receiving both SSI and SSDI, which is possible under certain circumstances, can see total monthly income that reaches or exceeds $1,400. Additionally, someone on SSDI whose benefit falls in the mid-range, particularly with any state supplement or spousal addition, can land right around that figure. It's not a single new check being mailed out. It's a realistic total for certain recipients based on their specific combination of benefits. If you're not sure what category you fall into, the clearest thing you can do is log into your My Social Security account at ssa.gov. Your updated benefit amount for 2026 is posted there, and you can also see a breakdown of how it was calculated. A 2.8% increase sounds modest when you say it out loud. And honestly, for a lot of people, it is. But let's put it in real terms. If your SSDI check was $1,400 per month in 2025, a 2.8% bump adds about $39 to your monthly payment, which works out to roughly $468 more over the course of a full year. That's not nothing. That's a utility bill. That's a month of groceries for one person. That's a copay on several medical appointments. For SSI, the jump from 967 to 994 represents $20 more each month, or about 324 annually. Again, not transformational, but real money for people who are working with tight budgets. The SSA commissioner put it plainly in the official announcement: the COLA is designed to help benefits reflect today's economic realities. It's not meant to make people wealthy. It's meant to preserve purchasing power so that a dollar stretches roughly as far this year as it did last year. Whether you feel like it accomplishes that is a fair question. Inflation has been uneven. Some costs, particularly housing and healthcare, have risen faster than the CPIW that drives COLA. But the increase is real, it's confirmed, and it's already showing up in payments. If you're receiving SSDI and you've been wondering whether you can work part-time without losing your benefits, there are some updated figures here too that are worth knowing. The substantial gainful activity limit, the monthly earnings threshold above which SSA may decide you're no longer disabled for SSDI purposes, has increased. In 2026, that cap is $1,690 per month for non-blind individuals and $2,830 per month for people who are statutorily blind. These figures are higher than they were in 2025. There's also something called the trial work period. This is a window of time where SSDI recipients are allowed to test whether they can return to work without immediately losing their benefits. The monthly earnings threshold for a month to count as a trial work month has risen to $160, and the rules remain the same. You get 9 trial work months within a 60-month rolling window before SSA takes a closer look at your case. These aren't dramatic changes, but they matter. If you've been hesitant to try going back to work because you were worried about crossing a line and losing your SSDI, these higher thresholds give you a little more room to test the waters. Now, here's where things get more complicated, and honestly, where your attention really matters right now. The payment amounts are going up. That part is settled. But the agency responsible for processing claims, resolving problems, and helping people navigate the system has been going through significant disruption over the past year. And that disruption is affecting real people. Beginning in early 2025, the Social Security Administration lost more than 7,000 employees, making it the largest single-year staffing cut in the agency's history. The reductions were part of a broader federal efficiency initiative. Field offices in multiple states were identified for closure or consolidation. 6 of the SSA's 10 regional offices were shut down. The result, according to advocates, researchers, and former agency officials, has been longer wait times, more difficulty reaching someone on the phone, and growing backlogs for people with pending disability claims. One figure from researchers at the Center on Budget and Policy Priorities stands out. Due to the staffing losses and new identity verification requirements, an estimated 1.93 million additional in-person office visits will be needed annually, because services that were previously handled by phone can no longer be completed that way. Beneficiaries who need to update their bank account information, for example, now have to either complete an online verification process or physically visit an office. For someone who is elderly, disabled, or living in a rural area hours away from the nearest SSA office, that's not a minor inconvenience. It can be a genuine barrier. A research study published by the American Economic Association found that Social Security field office closures were associated with a 16% decline in disability benefit receipt in nearby areas. Not because people stopped qualifying, but because they couldn't complete the process. Former SSA Commissioner Martin O'Malley, who ran the agency under the Biden administration, was blunt in his assessment. He warned that the cuts could lead to a collapse of service delivery. Benefits delayed, as advocates have put it, are benefits denied. If you're already receiving SSI or SSDI and your payments are coming in on time, you may not feel these disruptions directly, at least not yet. The payment systems themselves continue to run. Benefit checks and direct deposits are still going out on schedule. The COLA increase has been applied. That's the good news. But if you have any kind of open issue, a pending claim, a discrepancy in your record, a question about your benefit amount, a change in your living situation that affects your SSI eligibility, getting that resolved is going to take more patience than it used to. Wait times for phone calls have increased. Appointments at field offices are harder to get in some areas. And if you're in a rural community that lost its nearby office, You may now need to plan a long drive just to speak with someone in person. A few practical things worth knowing. First, set up a My Social Security account online at ssa.gov if you haven't already. A lot of what used to require a phone call, checking your benefit amount, reviewing your payment history, getting a benefit verification letter, can be done through that portal. It saves time and it puts the documentation right in your hands. Second, if you need to make a change to your direct deposit information, do it through that online account if at all possible. The new in-person verification requirement for phone-based banking changes has added a significant extra step for many people. Third, if you're helping an elderly or disabled family member manage their benefits, now is a good time to make sure their contact information at SSA is current and that they have access to their account. Because this channel covers a lot of different viewers, let's briefly revisit who qualifies for each program. This matters because the eligibility rules are different, and some people are receiving one but might be eligible for both. SSI, Supplemental Security Income, is based on financial need. You don't need a work history to qualify. What SSA looks at is your income and your assets. In general, you need to have limited resources, $2,000 or less for an individual, $3,000 for a couple, and your monthly income needs to fall below certain thresholds. SSI is also available to people over 65, not just those who are disabled. SSDI, Social Security Disability Insurance, requires a work history. You need to have worked in covered employment and paid Social Security taxes, and you typically need 40 work credits, roughly 10 years of work, to fully qualify. Your disability must meet SSA's definition, meaning it's expected to last at least 12 months or result in death, and it must prevent you from doing substantial work. Some people qualify for both, what SSA calls concurrent benefits. In those cases, you'd receive SSDI as your primary payment, and SSI may fill in a gap if your SSDI amount is low enough that your total income still falls below the SSI threshold. If you're not sure whether you might qualify for one or both programs, the SSA website has a screening tool, and a benefits counselor at your local SSA office or a nonprofit disability rights organization can help you sort it out. There's a broader policy debate happening right now around the future of Social Security, not just the administrative side, but the program itself. Congressional discussions about the federal budget have included proposals that affect SSDI and SSI in various ways, including changes to eligibility rules for certain categories of disabled individuals. Advocacy groups, including AARP and the Center on Budget and Policy Priorities, have been watching these discussions closely and pushing back on proposals they believe would reduce access or tighten eligibility in ways that could cut people off from needed benefits. What we know right now is that the programs themselves remain in place, funded, and paying out. But the political and administrative environment around them is more uncertain than it's been in quite some time. That's not meant to alarm you. It's meant to inform you so you can stay aware and, if it matters to you, make your voice heard with your elected representatives. There are several things worth keeping an eye on over the remainder of 2026. The SSA's staffing situation will continue to evolve. If additional office closures or service changes are announced, that will affect how accessible help is for people who need it. Monitoring news from the SSA's own website, ssa.gov, is a good habit. Processing times for disability claims remain a concern. If you or someone you know is in the middle of an initial application or an appeal, patience will be required, but so will persistence. Keeping records of everything, documenting communications, and following up regularly can make a meaningful difference in how long the process takes. And if you believe there's been an error in your benefit amount, or if your COLA increase didn't appear as expected, don't wait. Contact SSA directly, either online or by phone at 1-800-772-1213. The sooner you flag an issue, the sooner it can be corrected. So let's bring it back to where we started. The $1,400 figure you may have seen referenced in headlines or social media posts is real in the sense that many SSI and SSDI recipients, especially those receiving concurrent benefits or those in states with supplemental payments, have monthly income at or near that level. It's not a new bonus check. It's not a one-time payment. It's a realistic picture of what some recipients are taking home each month in 2026 after the COLA increase has been applied. The 2.8% adjustment means more money in your pocket compared to last year. Not a lot more, but a real and confirmed increase. The maximum individual SSI benefit is now $994 per month. The average SSDI payment is around $1,230 per month. And for couples or people receiving concurrent benefits, those numbers go higher. The more complicated part of the story is what's happening at the agency itself. Staffing cuts, office closures, and new verification requirements are creating access challenges for people who need help. That's worth taking seriously, especially if you have an unresolved issue or a pending claim. The payments are going out, the system is still running, but it's under more strain than usual. And knowing that means you can plan ahead, use the online tools available to you, and reach out sooner rather than later if something doesn't look right. We'll keep watching this situation and bring you updates as things develop. In the meantime, if you have questions about your specific benefit amount or eligibility, the most reliable place to get answers is ssa.gov or a qualified benefits counselor in your area. Take care of yourselves, and we'll see you in the next one.